It's Submitting Live with Ty Gay and Chase Hill.
Hello, Internet. We're back. That's right. Submitting Live podcast with your favorite, Chase and Hill, and your second favorite, Ty Gay. Today we have a guest on the show, Caple Spence. Hey, man. Thanks for being on the show. Appreciate
No problem.
you being
Thanks
here.
Thank you, Caple. Thanks for having me, guys.
And you are a superhero. Is this correct? No, wait. Neuro.
Not even close.
What is your title?
I am a neurosurgeon.
Neurosurgeon.
I'm a guy, actually, who happens to do neurosurgery.
So that's like brain surgery.
Brain, spine, spinal cord, peripheral nerve.
Great. That's good. We want to talk to you. And you're also a practitioner of the beautiful art of Jiu-Jitsu. Is this correct?
Yes, sir. I am. I'm loving it.
Pretty fantastic. Yeah, so we want to discuss a few things. We got some questions from the interwebs and also from ourselves, the interwebs of my mind.
Just our own brains.
Yeah, so one of the things that I've run into some issues with when teaching self-defense, especially to like battered women's shelters and things like this, they are really apprehensive about doing any kind of martial art because of the choking aspect of it or striking or anything, that kind of stuff. So they don't want a martial art that fights back, basically. They just want to preserve the person, which is great. Jiu-Jitsu is great for that. But they were just super against the choking aspect of jiu-jitsu, and then they went off to send me a bunch of things about how choking is just horrible for the brain, horrible for you, horrible for, you should never do it. And I thought that was strange because I've grown up in a world for half of my life where we've been choking, me and my friends, every day, a lot. And so I just want to understand, what are the dangers? Is it because of some people that are being like severely choked? Is that the difference? Or am I putting myself and my students at risk all the time? What's going on with that?
I was thinking a lot about answering this question and addressing this. And it's, I can get very technical and we can go into a lot of the nuance. And I don't know how deep it should get. What I would say is this.
We're kind of stupid, so let's talk like we're kids.
Yeah, no, there's blood vessels that go into the brain, into the skull. There are blood vessels that come out of the skull. Okay, the ones that go into the skull are arteries. The one that comes out of the skull are veins. When you measure the pressure in the veins, that's called central venous pressure. That just gives you a sense of it. Everybody knows like 120/80. That 120/80 is in the arteries, so that's the amount of pressure that's in there. The amount of pressure that's in the veins runs in the single digits. It's like 7 to 9. So whereas it's like your blood pressure, the pressure in your arteries gets up to like 120. The pressure in your veins only ever gets up to like 9 or 10. So that's just to tell you that the amount of pressure it takes to close the veins is nothing. But all that does is stop the blood flow from coming out. It still doesn't stop the blood flow from going in. So in order to, when a choke happens in jiu-jitsu, so we should probably take a step there and then kind of talk about what the difference between medical choking and jiu-jitsu choking. So in medicine, when you say that someone's choking, that's usually airway. It's not actual blood choking like we talk about, like what we try to do in jiu-jitsu. So if I say someone's choking, that means that there's a foreign body in their mouth, their tongue, and they can't exchange air. And so we take that out. In jiu-jitsu, when somebody says choking, they're talking about preventing blood flow from going into the brain. And both of you have taught that, there's a couple of different mechanisms that goes on with the neck. You can crank the neck, which disrupts the structure of the neck and causes pain. You can squeeze the larynx, that also causes pain, and that can close off the airway. But most of the chokes, when we say choke, we mean close off the blood vessels. So that's the distinction between medical choking and jiu-jitsu choking. Medical choking is airway. Jiu-jitsu choking is like everything in the neck. But usually when we talk about it, something that we do that makes someone black out, that's occluding the blood vessels. So now we're down to the blood vessels. Of the blood vessels, if you occlude the veins alone, all you do is cause pressure to build up in the head. People get a headache over time, but they won't necessarily black out right away. So think about whenever you've done a handstand. If you held a handstand for a very long time, your heart is still pumping blood to the brain, but because your head is down, the blood's not coming out. Your head feels like it's pulsating and it expands, but you don't necessarily pass out. If you go some long period of time, you might feel woozy, and then you take the handstand down. That's the equivalent of what would happen if you just squeeze the veins. So now we're down to the arteries. What happens when you squeeze the arteries? Well, first, in order for you to occlude the arteries, you have to apply more pressure than the veins can tolerate. So whenever you squeeze the carotids enough to obscure flow to the brain, by definition, you've pretty much compressed the veins also. But when you squeeze the carotids and there is a lack of blood flow to the brain, then people can pass out. So let's take a step back and we'll give a common thing that people probably heard about. You know, if you've heard of somebody passing out, like an older person that has an arrhythmia, what's the mechanism? The heart is pumping and it pumps on a certain rhythm. If something happens with that rhythm and the heart stops pumping, they pass out. So that just gives you a sensitivity that it doesn't have to be a long time for you to go without a pressure head going to the brain. And in fact, you can pass out anywhere from 15 seconds up to, let's say, a minute, maybe even 2 minutes of no flow or poor flow. And you'll pass out because you don't have any oxygen going to the brain. And it's not blood per se, as if you have to have blood, although the blood is carrying the oxygen. It's really oxygen. So, for example, if somebody has carbon monoxide poisoning, like somebody, people that are in an enclosed space, their heart is still pumping, but they're not getting oxygen to the brain, so they pass out. So that's an example where it's not that you're stopping flow, you're just not getting oxygen to the brain. So that's jiu-jitsu choking, is obscuring the oxygen, getting to the brain. And if you hold it for a short amount of time, then the brain fails, or it ceases to function. You take off the choke, blood is restored, blood flow is restored, and then people function again. And you can do this. I mean, it's not advisable, obviously, to be doing it to an extent where the brain is significantly impacted, but to obscure the blood flow and return it, generally speaking, and I'm just saying generally speaking, is not a significant event.
And so you would say, like, especially if people are, say, tapping as opposed to just going to sleep, relatively safe.
Yes, and I say relatively safe because there's a couple of disqualifiers here that I probably should mention. You can have atherosclerosis, plaque in your arteries, okay? And typically when plaque is in the arteries, and people know of strokes, and they tell people have had what's called a TIA, transient ischemic attack. It's a mini stroke, so people have heard of strokes and mini strokes. The way a mini stroke happens is a little piece of plaque comes off in the carotid artery and goes up into the brain, and it cuts off blood supply, and that part of the brain doesn't work. That's what a stroke is. So when you talk about choking and you're saying, well, so it shouldn't generally be an issue, it depends on the age. So if you have young people who generally don't have any atherosclerotic disease, it shouldn't be an issue. But if you take somebody 50s, 60s, and you put certain types of choking moves on them, can it be that depending upon how aggressively it's done, can you, just like, I tell people this all the time, the same stuff that can happen to people at home. So my mom was just sitting at home and all of a sudden she had a stroke, is the same stuff that can happen on the jiu-jitsu mat. And people might then say, oh, this is due to the choking. You couldn't argue that it wasn't because you were manipulating the neck, but the mechanism in that case would be you squeeze the neck, you cause a little bit of plaque to come off, and then it went up there. But it would be hard pressed, of course, because in jiu-jitsu we're choking. You'd say, oh, the jiu-jitsu caused it, but it wouldn't happen in somebody who didn't already have that disease.
Fascinating. So what about tearing the arteries or carotids or stuff like that? I've heard of that happening before in a couple of instances, but the guys, from what I understood, they were like either one was in a tournament and the other one was just a really tough guy that just wouldn't tap. And it tore something in the artery or something like that. How common is that kind of stuff?
So what you're describing is, in medical terms, we would theoretically call it a dissection. And what a dissection is, think about having a hose, and the hose, let's say, has a liner. And what can happen is when you put certain types of movement, shearing forces on the artery, like let's say you put the hose between your hands and you rubbed it like this, you could cause...
So gross. This is just grossing me out, this whole conversation. I knew this was going to happen.
I love it.
You could cause the inner lining of that hose to come off, and blood can get stuck in there. And when blood gets stuck in there, it closes off the hole. And then basically it's like causing a lack of blood supply to the brain. This is called a dissection. I will tell you that the amount of force that it takes to apply to do that, and the type of mechanism of injury, it would be hard for me to believe it could happen in a tournament, because usually when it happens to people, they have a lot of rotation of their neck. So car accidents where their head gets swung around, it more commonly happens when you're operating on the carotid and you cut the carotid open, and then there's a little flap there that you should sew back, and you may not miss it or something, and the blood goes up in there.
So like if an artery gets cut, you said a little flap, you have to sew it?
Oh yeah, you sew it back together.
How big are these needles that you're sewing with, bro?
They're
very, very small. They have to be very small.
They're small, but
my God.
hey, that's how people take plaque out of people's carotid when they have carotid disease, and people say they have, I need to get the carotids cleaned out. So that should give you an indication. There are people that do that operation, and some of them will just clamp the carotid on either side. And for many people, it's sufficient to just clamp the carotid, open it up, clean it out, sew it back together, so they can actually go without flow on one side. So when people say, about choking, for vascular surgeons who operate on people, for a certain subset of people, they can actually clamp the carotid on one side and do an operation without disrupting flow, because most people's brain gets supplied by both sides. But in jiu-jitsu, we're closing off both of them at the same time, and that's the difference.
When I have a question. When you were talking about the idea of a relatively safe time period, talking about when the choke happens, I know me and Ty have always kind of taught relatively for someone to go to sleep. It's anything from realistically 10 seconds to 30 seconds for some people.
Yeah.
What is, like, when you said relatively safe, when people, if they're tapping, but what would be a point to where it is too dangerous? Like, how long do you realistically think that damage would have to be held for a choke to cause either brain damage or other things? Because this is always a debate in the jiu-jitsu community of, like, how long should you actually hold a choke for?
Yeah, so I'm going to give a bunch of good disqualifiers. This is assuming that you're not injuring the larynx.
Correct.
This is assuming you're not cranking the neck.
I have a perfect rear naked choke.
Right. Well, because the cranking of the neck, there are 4 arteries that go up into the brain, okay? 2 of them are the carotid arteries, and they're sitting right underneath these sternocleidomastoids. 2 of them are the vertebral arteries. The vertebral arteries are in the bony structure. So when you crank someone's neck, you could occlude a vertebral artery and cause a stroke, but you don't do anything to the carotids. So and that would more commonly happen with a headlock. So if I get in a headlock and I wrench your neck, I'm not squeezing your neck, so I'm actually not causing any injury to the carotids, but I can wrench it in such a way that either cause a dissection in the vertebral arteries and cause a stroke, or I occlude the vertebral artery because I crank it so much. So assuming we're not talking about those 2 arteries that are in the bones, and we're just talking about the carotid artery, what I will say is this. There are people who free dive, for example. So they hold their breath.
That's crazy. Yeah.
And they can go 2 minutes. There are people who free dive longer than 2 minutes. Now, they don't have any oxygen. They have flow. Okay, they have no oxygen but flow. What I would, most people, if they go without blood flow, and therefore no oxygen to the brain for about 10 minutes, they probably 10 to 15. Clearly, at the 15-minute point, irreparable brain injury. So
10 to 15.
10 to 15 minutes of no flow. So that means you held this choke. And you held it sufficiently tight enough that no flow was coming up through the carotids. Even then, in instances, there would still be flow up through the vertebral arteries because they're surrounded by bone. But I would say if you squeeze somebody's neck to the point where they passed out, you pretty much obscured the blood flow to the carotid, then the front part of the brain and the major part of the brain. If you did that for 10 minutes, you likely would cause irreparable brain injury to the point where they might actually die just from that injury alone. Okay, so for example, somebody gets into a car accident and is found down and not breathing at the scene, no oxygen, no flow. If they're down for 10 to 15 minutes, and even if they get resuscitated, they'll have what's called anoxic brain injury. They'll have severe brain injury due to the lack of blood flow and oxygen, such that these areas of the brain will die. And even after their brainstem may be working and they can breathe reflexively and responsively, they may blink and they may have a reflexive movement, they will not have any brain activity in terms of higher functioning, thinking, speaking.
That's a lot
stuff
longer
like
than
that.
I thought. Like
That's what I'm.
Well, the
that's
reason
what I'm
I tell
saying.
you, but the
That's
reason
why
I tell
asked
you
that.
that, but the reason I tell you that is that's fair. That's been fairly well worked out, right? So there's the end point of causing essentially irreparable brain injury, potentially death due to that type of injury. And then you're talking about free divers who go without oxygen per se for minutes, but they have blood flow. So if you're talking about now jiu-jitsu, and we can break that gradation down to strokes, and so how long can somebody have a stroke when they reperfuse the stroke in the hospital and then get back function? But if we're talking about somebody who's awake and alert on the mat, and you squeeze their neck and they say, "Can you stop?" You're not doing anything of significance to them at all whatsoever. Now, if
and that's
they
why we don't
pass
see
out,
people dying all the time.
that's correct. Right. So that's why
Yeah.
that's why I give it to you that way. If you stop blood flow completely and there's no oxygen, no flow, you can do it for 10 minutes and they'll be dead. If somebody's awake the whole time that you're doing something to them, by definition, you're not doing anything of significance. Now, if someone, I think a more interesting question or difficult question is, you choke someone, and let's say you put on a very quick choke, not forcible, but quick, and they pass out, or they go out. You're just doing something, you don't even hear them tap, but you know that it wasn't a minute or 2 minutes. This is not someone who is suffering a problem as a function of the choke per se. This is somebody who's having a problem related to some underlying medical issue. So what types of things? I think you and I talked about this once. If you come into the hospital with a rapid heartbeat, sometimes they'll do what's called carotid massage. What will they do? They will squeeze the side of your neck and massage it, and there are receptors in your carotids that respond to pressure. When your blood pressure goes up, these receptors tell your heart to slow things down. They're called baroreceptors. So when people come in with very high, fast heart rates, they do what's called a carotid massage. They squeeze and gently massage the carotids, and what do you think happens? People's heart rates can come down. So there are people that if you can get them in a certain position and choke them, you're maybe squeezing their carotids and then their blood pressure drops out, and that's why they pass out, not because you're obscuring flow to the brain, but because you lowered their heart rate. So that's why if you knew the choke wasn't on for any more than a few seconds and they're passed out, that's not the jiu-jitsu choke, and you didn't obscure blood flow to the brain. It was some other thing, i.e. an older person maybe had a stroke or passed out because of that, or somebody who has an underlying seizure disorder or something. But it wasn't that you stopped blood flow to the brain and that's what caused it.
Fascinating.
That's crazy.
That is crazy.
Now, if it's on for a few minutes and you're a fight in the street and somebody, puts it on and the guy's flailing and you don't really know, and then they go limp and maybe there's a lot of adrenaline and you're just holding it and you lose track of time. Can you hold it to the point where somebody might have irreparable injury? Yeah. That's the 3, 4, 5 minute point of no flow to the brain. And I would say, generally speaking, kind of unlikely somebody holds a choke like that for 3 to 5 minutes.
Right.
Minutes with somebody passed out, not flailing, because if they're flailing, there's still flow to the brain and they're still doing stuff. So they'd have to be limp. Think about this. They'd have to be limp and you're choking them for 3 to 5 minutes and they're limp, passed out, I think, before you're going to be causing something would be irreparable injury.
Well, let me ask you about this. What about the dangers of concussions, like getting hit really hard in the head? Can you recover from that?
Yeah, CTE is really big right now. It's a huge conversation.
I think a lot of kids that are getting into MMA right now do not understand the dangers of it. And I don't think there's anything wrong with MMA. I just think that we should all understand what's really going on.
Not even just
there,
MMA, but like football or all kind of contact sports.
Yeah, so this is all these subjects have a lot of medical background to them, and I'm going to try to distill it down a lot. So what I will say is this: there's a bunch of different grading systems that are used to classify concussions, and a concussion is an alteration of consciousness. It's actually a clinical diagnosis. So if you say I got hit in the head and I blacked out, that's a concussion. Okay? You don't. So there's no CT evidence. There's no scan that you can do that actually makes the diagnosis. So it's largely clinical. So he got hit. I saw him act a little bit woozy. That's a concussion. And then the grading systems grade them mild, moderate, severe based upon a number of different factors. So let's take the worst case scenario, and then we'll work our way back. Since it's a clinical thing, if you felt you were blacked out or you felt you were woozy, by definition you have a concussion, and then we can grade it from mild upwards. So let's take brain injury. If I hit you in the head with an object and break the skull and injure the brain and cause bleeding in the brain, that's the worst type of injury that can happen to you. Okay.
Holy shit! Yeah,
That's the worst type of injury. So this
pretty
is
bad.
This is car accidents, hitting an airbag, hitting the windshield, being ejected from the car, hitting it on the ground, a baseball bat to the head, bottle to the head, falling down, hitting your head on the stairs. All the types of things that happen in life. That severe brain injury usually occurs, and it takes a couple of different types. One, penetrating injury. Something's broken and goes into the brain. You have to go in there, fish it out, clean it up, repair it, right? And then they deal with the underlying brain injury related to that, because when you repair this stuff, you repair the skull, you repair the scalp. You can take problem things out, but you can't repair the brain directly. So you take the pressure off, right? So that's open injury, penetrating injury. Then there's a subset of injuries called closed head injuries. This is where somebody hits you, let's say open palm to the head, or something where you fall down, no obvious injury on the outside part of the skull or in the scalp, but you hear people go home, they felt fine, they went home, they went to sleep, never woke up again. So there's a subset of blood clots that can occur underneath the skull because of the brain shifting very rapidly due to force. And so there are three basic types of blood clots. Two that occur on the outside of the brain, inside the skull, but outside the brain because there's a space in there. One's called an epidural hematoma, epi outside of the brain. One's called a subdural hematoma. It's underneath the covering of the brain. So one's above the covering of the brain, one's below the covering of the brain, but both of them are outside of the brain. In other words, inside the skull, but then there's a brain. And then there's blood clots into the brain. Think of this like a bruise. If you get hit and you see a black and blue, the black and blue is actually in the substance of the skin. You can have a bruise like that that's in the substance of the brain. So these all come under the class of closed head injury. So the first one I talked about is penetrating. Something went into the brain and the skull and what have you. Closed head injury is typically what you're talking about in your projectile sports. Things are thrown. Baseball to the head, football to the head, soccer, heading a soccer ball, getting hit. So this is the football, boxing, those types of things. So in those types of disciplines, getting hit in such a way that it causes a rotational movement on the brain is what causes this bleeding on the outside or inside the brain. Now that's blood clots and where they can occur. And then there's another type of injury that we should talk about, which is what's called a diffuse axonal shear injury. It means bruising, like small bruising within the brain, and it happens when the brain is turned very rapidly. So think about a hook punch to the chin. Think about something like that where the brain is not concussed in such a way that the side of the head or anything is struck and the brain is not jiggling against the inside of the skull. It's rotating. And because the brain has two different types of matter, gray matter and white matter. The white matter is very firm. The gray matter is a little bit softer. And where those two things can shear against each other, you can get these bleeding things in there. These can be seen on imaging studies, on MRI and CT scan, and so that constitutes a difference. Can you have a shear injury with no blood clot? Yes. Can you have blood clots with no shear injury? Yes. Can you have a penetrating injury to the head with none of the others? Unlikely, because usually the force is so great that you have all three of them. So you can have those penetrating, closed head that's blood clot related, whether it's outside or inside the brain. Then you can have shear injuries. And if you don't have any of those, you can still have a concussion. So
getting hit in the head is a bad idea. Is that what we're saying?
So the things that happen in MMA and in fighting are going to be the concussion. I got hit. I don't know what happened. I blacked out and I feel woozy. Concussion by definition. I can scan your brain. I don't see the shear injury. I don't see the blood clots. I don't see anything penetrating, but you had brain injury clinically. And can you also be struck significantly in the side of the head and cause a blood clot? Sure. Can you be hit, uppercut and cross and then end up with a shear injury, a vertebral artery injury, and some of the other things we mentioned relative to the neck? Yes, because all of those are possible in striking sports. So when we're talking about the consequences of getting struck, you realize in my mind, I'm trying to exclude all those different mechanisms, and your question is specifically this, but it's rarely ever just that. In other words, if I twist your head really rapidly and don't cause you to hurt, you can still feel a little bit woozy just because your head spun. And you might say that's in the brain because of a concussion. It's not. It's a middle ear problem. Okay? So there's a lot of different mechanisms that are going on in a fight situation to try to strip out just the brain injury part. But having said that, to get struck in the head, the thing that causes the problem with brain injury is what's called acceleration deceleration. To have your brain going from stationary to instantaneously being accelerated by striking it is what causes the bruising. And if you bruise anything repetitively over time,
It's going to cause problems.
it's going to cause problems primarily because the brain is electrical jello. I mean, that's one way to think about it, right? It's a mass of jelly cells that are conducting information, and it conducts it. Nothing's moving in there. Really, it's just the sensitivity of one cell electrically to the sensitivity of another cell's electrically, and they relate to each other and they share electrical signal. All you have to do is jolt it for it to change. So if you bruise the brain, you cut off certain pathways of conduction, you make things that conducted at a certain speed conduct slower, you make things that used to conduct in a certain direction not go in that direction, and it can cause a lot of havoc, obviously.
So, with all that being said, we didn't really talk a whole lot about this, but you have an extensive martial arts background. Mm-hmm. So not just in jiu-jitsu, you've done all kinds of arts and stuff. So with that being said, is there anyone that you recommend to not participate in, like, if there was if you had a patient, for example, and they had such issues that you could already identify, is there anyone that you would say that should not participate in, like, jiu-jitsu or MMA or contact sports? Like, is there a prime candidate?
No, I always have to take these things case by case, and the reason I say that is, I'll get the high school football player that comes in with a flail arm. So they got hit, they got tackled, hit on the side of the neck, probably injured the nerves here. They can't move their arm. It's neurologic. It looks like a big deal, but after a little while, they can move it again. Yes, they have to take a little time off, and they can get back to contact sports. And so if somebody who's in jiu-jitsu or MMA or contact sports comes in with an injury that is, self-limiting and will go away, I don't, generally speaking, I think they can return to it. The times when you're concerned is repetitive. People, somebody gets knocked out, or they have what you believe to be a concussion, and they are exhibiting symptoms still, headaches, vomit, and nausea, dizziness, difficulty concentrating, things that indicate that their brain is not necessarily functioning and it takes them a while to recover. That person, you want to kind of make recommendations that they kind of watch the contact, see if they can avoid it, and then if they really want to get back to it, provided the symptoms have cleared up, they can get back to it. If it happens again, I generally tell them to find something else because I just don't think it's worth it.
Right.
Yeah.
Having said that, I think that relates to, in my mind, mostly to those types of sports and events that you can't control. I mean, if you enjoy martial arts and you're practicing in controlled situations, you like boxing and you like the working out, you can even spar, but don't get hit to the head.
Yeah.
But I think the reason I kind of am very careful is that I've told people, for example, I've had patients come to me that do jiu-jitsu, and they've had cervical fusions, and they've had 1 or 2 or 3, and I would say to them, you can practice, but there's no chokes. There's no headlocks. So if you take them away and they can go into that training situation and still enjoy themselves, I don't see a reason to tell somebody not to do something. But it's the same as if somebody had a bad shoulder, and you say this in class all the time. If there's a problem, tell your partner what the problem is, and they work around it. And if you can have that type of environment, I don't think there's a reason why people shouldn't be able to train.
Well, see, and that's always kind of what you hear. You hear of everything. Oh, well, if I've had all these injuries or whatever, like, who is the prime person to not train or to train? And us, one reason why I asked that is because me, obviously, as you know, you're our student, but like we run a school. And so is there a person, like, do you recommend, like, they should fill out like almost like a PAR-Q? Like, should we take information down from certain people, like if they've had these previous injuries, or should they be able to make those own decisions? Like, looking at it from our standpoint, like, should I teach this person that's had all these injuries and to make it worse, or should we not? Like, that's more of a business decision that me and him have to make. But from a medical standpoint, like, if someone comes to me and has all these things, well, hopefully they're
that's
not
up to
coming
the
in.
individual. They've got their own lives and their own stuff. They should disclose that, I feel like, in the beginning of any kind of practice. I had a friend reach out to me the other day that has some issues going on. I think it was with his heart or something like that. Was asking me if he should go train at this jiu-jitsu school. And my thing first was just make sure that you disclose everything that's going on with you to whoever you're training with. That just keeps everybody on the up and up. Mm-hmm. And then it's up to that individual.
I here's what I will say. It's in everyone's best interest for everyone to disclose the relevant information and to use their head. Having said that, there are people who completely disconnect the fact that, for example, they may have some type of problem, especially a beginning student who may not necessarily know all the things that they might go through.
True.
They won't come in and say, oh, I know that you're going to teach this type of technique or in this way, and that because I know you're going to do that at some point in time, here's the thing. I think probably what's safest, especially in strenuous, and I would say, CrossFit or a boxing gym or boot camps, I think people should disclose that stuff and fill it out on a form, and then, but then it would also behoove the owners to look at it and say, hey, I don't think this may not be right for you because it sounds like you have this. What you always see is consult your doctor before engaging in it.
That's what I was going to ask.
That's always something to do, because I think, and Ty and I have talked about this before, the issue of liability. You hate to talk about it, but it's a real part of life, is if somebody comes into the jiu-jitsu dojo and doesn't disclose a health condition and has an untoward event happen on the mat, you'd have to theoretically to prove that you were not related to the cause of whatever the problem was, and you get into this thing of going back and forth and when it happened and who saw it. And I think it's just a lot easier if people would just put all the information out on the table. And I would say, and you guys may laugh at it, to me, when you come into your school, your students are like entrusting their bodies and their well-being to you guys, that they should disclose to you, hey, this is the limitation I'm dealing with. I'd like to learn what you have to teach. Can you teach it to me in a safe fashion and take into consideration my situation and help me? And if they don't disclose that information to you, then, obviously bad things can happen.
Sure.
So if you're a person thinking about training jiu-jitsu and you've had any of these issues, you should for sure disclose it.
And talk with your physician.
Talk with your physician, right? And talk to your training partners and stuff.
The docs may not know, everything about what you do, but certainly, I think you guys do, and they should be able to come in and say, I have a heart problem, or I have this, I have that, I have the other. And then you guys, when you're on the mat, it's just a matter of communicating with the instructors and just, or you may even take a particular student aside and say, hey, we're going to be doing a lot of X, Y, Z today, and it may not be a great class for you. And I think anybody would appreciate that and should appreciate that.
I would hope so.
I think, we're lucky in the fact that we're very, we're in our students' lives a lot. And we're really trying to do things on a trying to change things fundamentally for them right in the very beginning. So we're trying to ask questions a lot in the beginning. But my concern is for other gyms that aren't really that way. It's just, hey, come on in. There's only one class, and everybody just kind of does, they roll at the end, all that kind of stuff. I feel like that scenario is probably a little more dangerous than what we have going on there right now. And I think that gyms are moving more towards the model that we're using because it's just financially it's just better because you can get more people in the door. But I think that safety is paramount. That's the one thing. Even when my guys go to compete, we had a bunch of students compete over the weekend, and my main concern, they'll all tell you, my only concern is just that they don't get hurt. I don't care if you win, if you lose, you're not going to disgrace the school by losing in 3 seconds. It doesn't matter. And you're not going to bring glory to the school by winning in 3 seconds. Just don't break yourself.
Or pass out.
Okay, so let's see here.
That was a good in-depth talk there.
That was pretty good.
That was
I
awesome.
hope that was helpful.
So you're a neurosurgeon, obviously. So how has neurosurgery or just the things that you do changed since you first started doing surgery to now? Has there been any leaps in technology? Has there been any major changes that you could see?
Well, I will tell you,
basically the same.
Yeah, no, it's not. It's not at all the same. For people who don't know what neurosurgeons do, they treat brain, spine, spinal cord, and peripheral nerve problems. So that basically is everything that involves the nerves or the brain in the body. And then there's a number of subspecialties of neurosurgery. So there's pediatrics, vascular, oncology, spine, peripheral nerve, functional, skull base, critical care. So there's a bunch of different subspecialties, and every one of these subspecialties has research that's going on just specifically in that area. So for example, you may be a neurovascular guy and doing aneurysms and AVMs, which are blood vessel problems in the brain and what have you, and not necessarily know a lot about the cutting edge in pediatric oncology, brain tumors in kids.
Yeah.
Well, because it's neurosurgery, but there's subspecialty areas of it. Okay. And I would say that in the last 15, 20 years, the things that have occurred experimentally, it's huge. And even if you look in spine and in the things that get done, pedicle screws came out in the 90s. So people, commonly you say, I don't want screws in my back and what have you. That's not in the 1990s, and they didn't have minimally invasive surgery at that time. So these small incisions where they can go in. Now, the operation fundamentally was the same. You went in there, trimmed away some bone, and made more space for the nerves to make the pain go away. But how they do it has changed dramatically in the last 15 years. Minimally invasive endoscopic surgery where they use little cameras to go in and look. That's changed significantly just in spine alone, much less in the brain. So what things have happened in the brain? Robotic surgery. So they do it in the hearts. They use robotic surgery in heart, and because you basically can do smaller movements, more controlled movements, and finer movements. You think about things like peripheral nerve. They are able to grow, doing nerve transfers. So for somebody who loses their arm, they're able to take a nerve from one area and join it with another and get different function. I don't want to get too technical about it, but every one of these areas have had tremendous growth. And I think it's only going to improve, but there are limitations to our technology right now. And so we can think of a lot of different things. And, you think about circuitry and AI and all these other things that we see really blossoming out in the real world. You got to remember, we're still dealing with human beings, and there's a lot of technical things that we could do with a computer that generally we still can't necessarily make them interface directly with the human body.
What is the thing that you're like? Is there something that you're really excited for in the field that's like growing more, and you're like, man, I've been telling everyone about this for years, but no one's listened?
Well, I don't know that there's a lot more people who know a lot more than I do. So I don't know that I would say that. I think things that are kind of interesting to me, I think, is prostheses. And the reason I think about stuff like that is I just think about people who've lost something or people who have had disability. Yeah. So you lose an arm, you lose a leg, or you have a stroke, and the ability to create something that helps them to be more functional in day-to-day life, however that happens, I think is huge. And the ability to marry prosthetic technology, which we've had for a long time. They may have been very crude, but refining that prosthetics and then having them interface with us, when I say us, neural interface or other types of things, I think can be a huge game changer, because we have a whole subset of people who get injured in various things that once they get injured, they're kind of, think about using an iPhone or something like that. I was talking to somebody the other day that didn't know some of the assistive features on the phone and the different things that for disabled people, they never thought of themselves as having a disability or how it might benefit them. And I just think that there's we are so much more in tune with that type of stuff now, that I think that prostheses and functional improvement in people's lives, I think, is huge. I think stroke and stroke management is huge. If you go back probably 15, 20 years, people couldn't tell you what a stroke was, and they couldn't tell you if somebody was having a stroke. Nowadays, people know.
There's all this, there's information out there now. There's like videos and like they're teaching it in school how to identify it.
Exactly. And that's a huge improvement in neurologic outcome for people, because they can tell exactly what's going on. And I think that, I think another thing that's relevant, which is not something that's probably in the mainstream, is the treatment of neurovascular disease. If you had an aneurysm, when I first started training, so you go back into the early 90s, and you had an aneurysm, you were going to get a craniotomy to treat that. They were going
What's
to
a
have
craniotomy?
So a craniotomy is open up your skin,
Oh.
open up the skull.
Yuck!
Open up the skin, open up the skull, find a space, open up the space between the brain and the skull, find the blood vessel, and put a little like clothespin on the blood vessel. That's what I was doing when I was in training. And even when I came out, we were still doing that. And we were just on the cusp of having what's called now neurointerventional. So these are people, the neurosurgeons and or radiologists, who train to treat this very same problem by putting a catheter in the groin, and they can snake a catheter in the groin all the way up in there and put coils into the brain, and you don't get your head opened up. And I would say the standard of care when I first started training was to open up your skull to treat this problem. And the standard of care generally now is not. You come in and you can get treated through the groin for most of these problems, and
I'm not sure how I feel about this. In the beginning, it was like, we could cut your head off or your top of your skull off, and I was pretty grossed out by that. It's like, no, everything's better. Now we go right through your crotch.
It's very near the crotch, but it's not in the crotch.
Oh my God!
A little humor. Cable? There was a commercial that was out at one time where a doctor was doing like brain surgery, and it was a kayak commercial. It was like the website Kayak where you could search all the travel sites, and the neurosurgeon doctor was doing surgery, and he was cutting open the head, and he was able to, by pushing certain things in the brain, he had the patient that was on the table that was like typing everything like that. So, but now, I mean, that just seems funny that now, like what you're saying is that they're trying their best not to even ever open up the brain as much, or open up the head. Oh,
certainly. Yeah. I mean, when I started training, and in my residency, we did a lot of very complex reconstructive techniques with the skull, removing the eye, the side of the eye, and doing different things like that. But I will tell you, shortly after I started training, and certainly it's progressed tremendously, is the size of the craniotomies that they do now, the holes that they make have become smaller and smaller, and they're using all these different techniques to the point where they're trying essentially to get to the place where it is minimally invasive. When I first started training, what's called neuronavigation. So, for example, if you had a brain tumor, when I first started training, they were just starting to develop systems where we could put various things on your scalp. We would stick them on there and then use a computer, or even screw a frame onto your skull and then use a computer and in a scanner to help us localize problems in the brain. And now that software is tremendously better. You can do it without screwing something in the skull, into the skull. I mean, it's tremendous all the improvements that have happened. And people should be very happy that that they have this technology, because there are things that were not well treated before that are treated very, very well now with our current technology, and it'll only get better.
Yeah, that's pretty intense. So, and a lot of people have asked me about this, since this kind of goes right into this, but so what do you think about Neuralink, Elon Musk and his Neuralink? He says that he's making it to counter, I guess, AI if AI goes wrong, and so we can at least, if you can't beat them, join them type of thing. But I was talking with you not the other day, I think about it, and you were saying that some of the technology for that's been around for a while. So just tell me about what do you think?
I would say that this is one of those areas that I think is very, very complex, and it's difficult to talk about it in a real way. And when I say real way, there's theoretical stuff, and then there's actual practical day to day. The theoretical stuff leads research and pushes the envelope, and we get improvements from it that then trickle down to what we actually use on a day-to-day basis. So, are there particular parts of the brain, just like you mentioned, that are responsible for certain activities? Yes. And for example, when we do seizure surgery, sometimes we wake people up and stimulate the brain, talk to them, and interact with them with their skull opened in order to map certain parts of their brain.
So they're just awake, hanging out, talking to you about.
Well, you knock them out to do the craniotomy, and then you wake them back up.
Hey, how's this feel? Not good. Put me back to sleep.
So this is called
my head is off.
That's right. This is called an awake craniotomy, right? So
God.
we do awake craniotomies. And the patients they tolerate it okay, and it's done for certain.
What
when I
choice
say
do you
okay,
have? Like-
when I say okay, I mean they're under anesthesia, they don't feel the pain, and you wake them up so that you can test very eloquent areas that you can't really test any other way except talking to them, interacting with them, asking them to perform certain maneuvers, and it's done for seizure surgery. And the reason I say that is we would open up the skull and put electrodes on the actual surface of the brain, and we would record, and you're looking for where seizure focuses are coming from, foci, and then you may want to remove them or what have you. So we've been doing that for a very long time to know where these parts of the brain are that control what have you, and you've read these types of things. But to design circuitry that would then be implanted in such a way that you would be able to interface with it, we are very, very, very far away from that type of activity. That's number one. Number two is I think that there are and I think you and I may have talked about this a little bit when we talked about AI. There is a lot of ethical issues and other types of things that have yet to be addressed with the use of artificial intelligence. We're looking at issues of data control and data breaches with Facebook that to have an interface that potentially can be accessed through Wi-Fi or cellular data connections that is interfacing with us, and we don't have complete control of, and we're not even really sure about privacy issues and what we do about data and big data, I think are significant issues. I know Elon Musk is afraid of them, as well as there are others. But the truth of the situation is AI is in our day-to-day life all the time, and it's already here, and it's not going away. And we just have to find a way to manage it. But to get to the core of your question, do we have the technology right now whereby we can have an implantation that interfaces with us in our brain so that we can access data, push data into this device, or use it in that way? We do not. Now, do they designed glasses with heads-up displays that we can see data real time? Sure. Do they have are there ways for us to be able to have augmented experiences, VR goggles, or different types of information so that it's tied to location data? When you walk into a certain spot, they know that you're there and they can give you more information about your world. Sure. And I think that's probably coming very quickly. And much of that's here actually already. If you walk into a certain store, if I go into the Penn Square Mall, AMC says, hey, you're near an AMC and what have you. But having devices that will interface, no. Now, back to conventional neurosurgery. Are there diseases for which we implant things into the brain in order to do a specific thing? Yes. So for people with Parkinson's disease, for people with certain types of movement disorders, we can put an electrode into the brain in particular parts of the brain that deliver a signal, an impulse that will cause tremors to lessen, that will cause various things to stop. We have technology now that allows us to manipulate the brain in very crude ways. But do we have sophisticated technology that would allow us to be able to interface with it back and forth? We're very, very far from that. We're very far from that.
Well, I'm not sure if I feel good about that or not. So probably AI will be so powerful before we even get a Neuralink type thing that we're probably all screwed. But that's okay. Because
I think AI is going to do a lot of incredible things, by the way.
I think so.
I think it's going to do incredible things because it will allow us. I mean, think about it right now. We have conversations around, at dinner time, and we can talk about things, whereas before everybody'd say, I don't know, you don't know, we don't know. We look it up on our peripheral brain, and then we keep talking about it. We are not sure about data and information. We access it directly, and we include it in our experience. So I think the idea that we have devices on us, a watch, a phone, glasses, that give us more data and allow us to do more things in the world, I think it's going to be incredible. And with data aggregation and all the data that we build, are we going to need computers to help digest it and give us the things that you particularly want and give me the things I particularly want in the way that I want it? I think AI will be incredible for that. But all of the other things, I just was listening to a podcast about making rules of engagement for war for what robots will be allowed to do because they're concerned about drones being, having the AI built into them that
Or they just pick and choose who they kill?
Exactly. They're sent on a mission. If they identify a particular target, they have the, if based upon recognition, they have the carte blanche to shoot at it or not. These are the real questions that I think that we need to be asking. You know what I mean?
Yeah, we have a double exponential growth rate pattern that's going on between computing technology and robotics, so that could be pretty scary. Everybody's arming their robots, I can just see Terminator chasing me right now. That's all I'm thinking about. Shape shifting and whatever.
Hey, we're not far from a lot. There's a lot of robotics going on right now, and certainly, you hear it in the news, automation and people being afraid it's going to replace their jobs. But robotics has been in the car industry. Yep. And it's going into now food service and certainly, you can see in Japan and other areas where they're developing robots as life partners to be able to to be able to give medication. Yeah. So they fill up the medication, the robot follows you around, dispenses there's lots of these types of applications, and these are, for the people who are developing them, they're trying to use technology to help improve our lives. And I think there's just these ethical issues and question of what we are willing to tolerate and what's reasonable and what's not, that I think still has to be worked out.
Do you think that eventually AI and robotics or whatever will take mine and your job?
There definitely a whole bunch of jobs that it won't take your job, but there are certain aspects of my job that I think it definitely will take. And certainly if you look at what the projection is for what they're going to be able to design AI to do, I think you would expect that. So if you look at some of the things that are what are considered menial, in other words, can right now, for example, if you have an accountant and your accountant does your books, do you really need a human being to tabulate the data and verify numbers back and forth? There's going to be a point in time where that doesn't need to be happening. Now, are you going to need accountants to sift through information and understand businesses and the way they're constructed? Sure, but even accountants are going to ultimately use AI to help aggregate data and stuff. But you look at lawyers, they're talking about for simple contracts. Yep, I ought to be able to come up to you and say, hey, I want to sell you my house. We type the fact that we want to sell each other a house, put it into an application, and the application comes up with a legally binding contract within the state, and we don't have to go to a lawyer.
It's already generated for you. It's
That's
just
correct.
Automated.
And right now we have to call the attorney.
A lot of people, right?
Oh, yeah. And even in medicine, they're talking about having medical kiosks. So, if you think about going to the doctor,
scan your finger.
When you think, there are two things that probably they're not the same, but they're interrelated. Number one, medical kiosks. So going up to a kiosk and saying, in wintertime, I have the sniffles, a runny nose, and a cough and a sore throat, and having them say, you likely have this within your community, within this, you have this, take that, which is what people go to a family practice doctor for, okay, I think is one thing. And then telemedicine. Whether that kiosk is freestanding or whether it has some telemedicine component, which is if we get to a place in the algorithm of the kiosk where they don't know what it is, that the kiosk can then call some doc who is at a terminal, maybe manning a terminal, and can see your rash, can see your thing, and then give you advice, and then disconnect it, and the kiosk take over the rest, dispense medication, print out an instruction of what your exercise is for you to do. That stuff is well, some of that is already here, especially for places with that need rural medicine. There are places with no docs. They can set up a kiosk and have people do it. Right now, especially in Oklahoma, there's a big struggle in allied health, nurse practitioners, PAs, to be able to be trained and go out into rural areas where doctors aren't there and give medicine. They'll be able to put a kiosk there, and people in the community can go up, and for just your regular run-of-the-mill things that people already go on Google and look it up.
Like urgent care or whatever, but it'd be a kiosk.
Exactly. I mean, think about it. People already use Google for that. They Google everything, and they don't go to the hospital, and they don't go to whatever because they looked it up. Here, they're likely to be able to develop these systems where people can go someplace that, with a reasonable degree of medical certainty, get reliable information based upon the information they put in. That's not far away, and certainly some of that already exists. Telemedicine already exists, and if you look at electronic medical record, many hospitals now, you go in and tap your data in, and then they have it, and then the doctor reviews it, and they use software. I use software in my computer to check to make sure the medicines you're on don't interact. Any medicine I might put you on don't interact. All this stuff is already happening.
Wow.
So it's a matter of refinement, in my opinion.
And so that's the benefit to AI.
No question. No question. No question, because the amount of data that we're responsible for all the time, memorizing, knowing, looking up. And I mean, I still look up things all the time because they're numbers to this decimal point that you just don't remember. AI is going to take over a lot of that. But, these are things that we still have to work out in our culture, because I think people expect to walk into a room and talk to a person. And I think even if they got the same medical care, if they didn't get it from a person who they felt cared about them and talked to them, that they would question it still. So I think the technology will be helpful. I think it's great. It's great for society. It'll definitely displace people. It'll likely improve access to care and quality, not making medical errors and all these other things. But there's a lot of work still to be done.
Well, if it takes the jobs that it's projected to take away, for example, like trucking jobs, right? And that's like the largest, number one job in America is trucking.
3 million,
right?
I think there.
So if it takes that away, and like all these other jobs away, and even possibly brain surgery or whatever away, what's the fix to that? I know a lot of people talk about like universal income, basic income and stuff. What do you feel about stuff like that? Being a physician, how do you feel about that? What do you idea?
Well, I would say that there's a lot of things that AI is not going to be able to take away. And one of the things that they've talked about, although it's not so clear, is social sciences and social services. The need for someone, again, to walk into a room, human interaction. Now, funny enough, as I mentioned that, but to screen people. So in other words, if you walk in and to a place and to ask you a whole bunch of questions, like if you called up your credit card company or somebody to get on the phone and tell me about what's wrong with you today, that type of stuff, I think they'll be able to use AI for. But I think when the nuts and bolts of breaking a diagnosis of cancer to a patient, dealing with life and death issues, whether to treat or not to treat and the risks. I think that, I don't know that people are going to want a computer spitting out numbers to them and saying, hey, make a decision, press A, B, or C. There's always, I think, going to be a role for human interaction for that.
I hope so. I mean, I used to think that there would be no way that we would ever divulge all the information about our everyday lives either. And now we all do it every day on Facebook.
Oh, my gosh.
So I really don't know where we're going in this topsy-turvy world.
I'll tell you a funny thing. I think I think one time I came to the academy and you asked me if I used Venmo, and I didn't, and because I use PayPal and cards and what have you. And just the other day, Carlene and I needed to we needed to use Venmo. She already actually had it, so I said, "Son of a gun, I chased that son of a gun. He was asking me about this damn thing. I don't even have it now. Carlene has it. I don't have it. Let me download it." So I download this thing, and it says that all of the transactions are public unless you say
turn it off.
you say otherwise. But think about it. Here's an application where if you provided a service, I would take out a bill out of my pocket and give it to you, and no one else would know about it. And the default position for this application,
The default for it.
the default position for this application is that everybody can see that I paid you $5. It's incredible when you think about it, like that you guys are just saying, because that's the way the software is designed. And I told, we were sitting down for dinner, and I said, you got to make sure every time that there's a software update or something that it doesn't get turned back on. But big data and data aggregation to be able to identify us based upon our habits and our use of data and our location, it's not going away.
Oh, that's
It's not going away. That's correct.
So it's
even if theirs is turned off.
Yes.
Oh, yeah. Public record.
So I can go to somebody else's. Whatever.
Right.
Yeah.
It's disturbing to me. It's disturbing.
Well, you
to
hear
me.
these things like how some family or whatever they start getting like diapers is whatever commercial ads sent to them and whatever, and they're like, why is this? And it's because the daughter had went and got a pregnancy test at some point, and their algorithm caught it and started sending you all these things in email and whatever. So this has been going on for a while. I mean, Facebook isn't free, people. I mean, they're selling
it is
your
not
information
free.
for ads. It's like, and that's why that thing comes every once in a while. Oh, Facebook is getting ready to charge for Facebook. No, they're not. They've been charging for Facebook this whole time. You've been giving away your life and all your stuff that you do.
Not only that, but I think another thing that's really I hate to use the word subversive, but I can't think of any other way to do it, is these companies that acquire an application that you don't realize, and they say you can sign in with Facebook or something else. You may do the something else, and it still aggregates your data and recognizes that you use Facebook because they're a subsidiary of these companies, and you don't know that. And so they're not. You might say, "Well, I'm not on Facebook." Yeah, but if you use this, and this, you might as well be on it because they're still using your data.
They're going to find a way to get your data. That's the whole game.
That's
the
correct.
whole game, and they don't have to tell you that. They're
It's anonymous. They strip off all of your identifying information, and you don't have to worry about it, except they can tell you what toilet paper to buy next time.
That's right. That's so they can tell that whatever the new predator or whatever where I'm at, my location when they need to find me. For a drone strike. He's shape shifting, just flying after me. Great. Let's see here. Oh, here's one from the interwebs. I thought this was a fun one. Is there a difference between the male and female brain?
I'm gonna say generically no, and the reason I'm saying that is the overall regional anatomy. Is there anatomical differences in terms of the gross structure? No, they have frontal lobe, temporal lobe, occipital lobe, cerebellum, brainstem, whatever. General structure, architecture.
I could have sworn there's like 7 different parts in the female brain, and they're all designed to get us. Am I wrong? Oh man,
I'm not going to contribute to your comment. Your comment section. Your comment section is going to be alive.
Burned by myself. That's all right.
I think so. Structure, no. Electrical. I won't even say it that way, electrical activity, because we'll get to that in just a second. So the overall structure, no. I think that if you recognize, if I fill you up, if I inject you with a whole bunch of testosterone right now, you
feel awesome.
Right. This very same brain the very same electrical structure and neural architecture will function differently, will perceive things differently. You know that if you're roided up, you may be quick to anger, and what have you. Same brain, same electrical structure, same function, under metabolic differences. If I make your blood sugar go down, the same brain will function differently. If I give you adrenaline, the same brain will forget stuff. They may be flighted. You may become more focused. And so I think when we get to this issue of the difference between men and women in terms of their brain, I think that there's no question that hormones affect the way you process information, male or female. If I give you a lot of testosterone, if I give you a male a lot of testosterone, you're going to act in a certain way. If I give you estrogen, you're going to act in a certain way. If I give you thyroid hormone, you're going to act in a certain way. If I give you a lot of insulin, you're going to act in a certain way. And so for people, for example, that undergo sex change, do their physiology change because of the hormone regimen that they get? Yes. Do their attitudes change? Do their behaviors change? Yes. I know that there are guys who have low testosterone, and they tell me that when they get pellets, a certain number of pellets, they just feel like on top of the world. And they said they know that they've gotten too much one time because they were just angry all the time. And then once it wore off, they were a lot more calm and what have you. So I have guys tell me that, much less, and we all know that for women who are menstruating, when they're menstruating and their hormones are cycling, they potentially could be sleeping more irritable, more this, more that. Adolescents going through puberty, they may sleep more, they may be more irritable because their brain is acclimating to the shifting in hormones. So when we talk about the difference between male and female, it's kind of very interesting because the brain is the same, but consistent exposure to certain types of hormone over time causes changes to the brain. So if you look at the studies that look at meditation and the effect of meditation on the brain, if you meditate consistently for a few weeks to a few months, they have shown on MRI that you actually change the structure of the brain. They've been able to show that on functional MRI as well as others. So think to yourself, if you're exposed to a certain type of hormone for decades, do you not think that certain parts of your brain structurally have changed? And that's why I wanted to be very careful to say that the anatomy is the same, but if your ability to understand, both of your ability to understand kinesthetic data and tactile data is different than somebody who doesn't practice jiu-jitsu because you've done it for so long. Your brain is not the same as other people. And so I would say the same type of difference that you guys have because you've studied jiu-jitsu for so long. And if I touch you in a certain way, it automatically makes you process information in a certain way. I think you should think of the same thing between men and women is the exposure to hormones and life experience and all the other things that color who and what we are causes conformational changes in the brain that when you're presented with information, you just process it a certain way. And I think when we look at the differences in gender, it's largely related to social as well as hormone. If I give have I taken care of patients who are genetically female, but they're taking hormone replacement because they are identified as a male? Yes. And they have a certain way of behaving. They have a certain way of acting. And it's in part related to the fact that they're taking testosterone in addition to some other factors that may be relevant for them. So it's just the structure is the same, but I think so much more important is the hormonal influence as well as some of the other social and cultural influences that distinguish men from women.
That was a good answer.
That was a very good.
That was a way better answer than what I thought I was going to get.
That was PC in the sense of
that was great. You danced around that one beautifully.
But essentially, what you're saying is that there is a difference in how basically men and women's brains can process certain things and how it may take in the data.
Yeah.
And everything like that.
Yeah, because of the difference in the chemicals.
Difference in the hormones.
Different chemicals.
And everything
different
that's
chemicals
going on in the brain.
I mean, I like to, I try to draw an analogy. I was talking about this with a friend of mine recently. So, schizophrenia, which not to go off on a tangent. So schizophrenia is a a psychological disease. It's a brain disease, right? It generally presents in mid to late 20s, and more often in males. So you realize these are normal kids. And of course, you may find research data that might show that they're not entirely, but for all intents and purposes, normal kids, normal young kids, normal teenagers. And then all of a sudden, because of a chemical issue in the brain, potentially structural at some point in time, but chemical largely, they start to process data differently. And their processing of that data they experience as hearing a voice or seeing something that we don't experience, or experiencing information. And there's lots of different stories of various artists, whether they're visual or what have you, that when synesthetics, when they're presented with information, music, so various types of sounds, colors, and what have you, that their brain processes it differently, and it comes out in a completely different way to them. And so the brain is just an incredible organ. And so to think that there could be, a subset of people, because of hormonal things, that when they're presented with the very same data that you're presented with, that they come up with something that's completely different and unique. Yes, of course. People hear rain and they hear music, and other people are like, gosh, that's noise to me. That's the difference. Mm-hmm. It's just data processing.
That's fascinating. So that if that is the case, doesn't that kind of destroy the sense of self? Not in the sense of self, but our sense of self relies heavily on the environment that we're in and the chemicals that are in the brain, I guess. Yeah.
People have thought about this for forever. They've thought about the answer to that question forever. And, our ability to identify who we are is experiential. It's not until we can, and even after we can experience what the environment around us, somebody then puts a book in front of us, and you and I both read the book and we experience that book differently. But yeah, it's our ability. It boils down to how we perceive the world, and what and when presented with the same stimulus, why do you do what you do? Why do I do what I do? And the difference, I kind of tell people, I said, if somebody comes down from Mars, they would look at all of us as the same, even though, we distinguish ourselves being completely different from somebody from Germany. We think that we're completely different than somebody from Germany or Australia. But somebody comes down from Mars, they're like, you guys are all the same. You guys are all the same. And the truth of it is, we choose to identify certain things and then say, that's me. I am a guy from Germany, I'm a guy from America, and that's who I am. But the reality is, we're just choosing those things. Really what we are organisms that have certain, organs in us, and we choose to interpret the information that's coming into that organism in a certain way. And then we just, as human beings, we pick something that we believe is novel, and then we kind of explore it and experience it and then call that us. But I mean, we're animals just like anything else. It's not, wearing this sweatshirt is no more me than you wearing that. But do people run around saying, yeah, I'm all about this sweatshirt? Yeah. And that's who I am? But that's not really what defines us. Our biology is what defines us. Our genetics is what defines us. You could think whatever you want, but, if you have certain genetics, you're going to develop certain issues and certain things, right? And if you're brought up in certain environments, you're going to have certain behaviors in certain situations. If you learn Jiu-Jitsu, you're going to respond with Jiu-Jitsu. I mean, that's just the way it is.
Yeah, it's fascinating.
Which I think someone did ask this question, but you seem very passionate about the you seem very passionate about your field, which I appreciate, because you're doing a very...
Thank goodness.
Yeah. When you were going through like medical school, how did you decide that you wanted to... Did you always know you wanted to do neurosurgery, or was it like in medical school when you decided that?
I always wanted to...
Such an interesting profession.
I knew I wanted to be a doctor, and I always thought I wanted to be a surgeon, because I just wanted to, do things.
Pick and poke at people.
Pick and poke and stuff like that. But it wasn't until I got into medical school where up until medical school, I thought I wanted to do general surgery, because my concept of general surgery at that time was operating all over the body, which is what it was. But, general surgeons do a lot of other things that are kind of more like bowel and, focused and what have you. And when I got exposed to the fact that surgery really is like huge, I mean, because there's so much information to know that all this information gets subdivided, and you have to there's so much that you can't just do everything. You've got to figure out your little niche. And are you going to be an endocrine guy? Are you going to be an orthopedic surgeon? Are you going to be ears, nose, and throat, eyes? What are you going to do? That when I thought the next thing I thought, because I went to Mount Sinai for medical school, and they had a huge ENT department, and those guys would remove the jaw and tumors from the jaw and take your fibula out of your leg and reconstruct your jaw and then take a flap from your stomach. I mean, they were incredible. Wow. They would reconstruct your skull. It was huge. So I really thought I wanted to do that until I rotated on it, and I just didn't. I didn't want to do oncology all the time, and I thought it just didn't fit for me to be dealing with people with really bad diagnoses. In other words, you're only reconstructing people that have throat cancer, esophageal cancer, and other types of deformities. And so I went but it was so interesting and so novel and so fine and so technical that I really was drawn to it. But then they used to do combined cases with the ENT department, with the neurosurgery department. And so I would go and observe, and then I saw neurosurgery, and I just thought that was the coolest thing, because they could operate. One of the things that kind of married with what I wanted was, really neurosurgery is in the brain. It's in the neck, it's in the thoracic spine, it's through the abdomen, it's through the back, it's anywhere there's a nerve. So when I got to realize that really neurosurgeons kind of operated anywhere there are nerves, that really brought me back to the whole idea of general. Yeah, it just wasn't it wasn't general bowel, but it was all over the body. Like you have to know your anatomy of the whole thing, and I really enjoyed that.
That is fascinating. Okay, so somebody else had asked me how long and you may not even know this, but how long does the neuroactivity in the brain go on after cardiac arrest? After the heart stops and there's no more blood pumping, how long does the neural activity in there going to go on?
Well, that is
what kind is there? Is there a big explosion of it? I've heard a bunch of different things for different people, but I don't trust them.
That's a complicated question, because different parts of the brain function differently and require a different amount of oxygen. So in order to function optimally, and I'm trying to say this in broad ways. So that is to say, when someone suffers an anoxic injury, so they don't have enough oxygen or they don't have enough blood flow to the brain, certain parts of the brain that are very oxygen dependent die first.
Okay.
And then other parts hold on until a little bit later. That's number one. Number two, the brain is supplied by 4 blood vessels, and what we call the brain, generally speaking, which is kind of the frontal lobe, and this top part is generally supplied by the carotid artery, and the brain stem, so the things that kind of deal with vegetative function, are usually supplied by the back, the vertebral arteries, generically speaking. When people find themselves injured in such a way that they lose flow to the brain, it's usually the information that you guys keep asking me about. We really get it out of car accident information and strokes and cardiac arrest and things like that. And those are not really clean models, because there's always other stuff going on with those P's and other variables. But I would say so you can have somebody who has brain stem function. They've been anoxic. They have anoxic injury. They didn't get blood flow to their brain for 10 minutes or 15 minutes. They have no supratentorial function. They don't wake up, respond, or anything, but they breathe. And breathing is a brain function. And that is something where if they were breathing still, then you would say they had brain function, but it's not functional brain.
It's not cognitive brain function.
Correct. After about, as we talked about, after about 20, 30 minutes of no blood flow to the brain, generally speaking, people they're not going to have functional brain. And what you do when you're trying to determine this is there are a couple of different tests that you can do. Cerebral blood flow test you can do at the hospital. They can do an angiogram to see if there's any blood flow up to the brain. And when they do those tests, if there's no flow there, If there's no functional oxygen being used by the brain, then they can say that you're brain dead. And there's some bedside tests that you can do, but it's never so simple, and you usually end up doing a test to figure it out. But a half an hour of if we're coding somebody and we're pumping on their chest and breathing for them, and we can't get them to respond after about 30 minutes or so, 40 minutes, we usually stop those types of efforts.
Okay, so let's say this is down the rabbit hole. So let's say that the body's failing or whatever, and we could. Can you see in the future where we could save someone's brain? Right? I don't want to say put it in a jar or something, but save the head maybe. And maybe because I saw there was something a couple years ago where they were trying to do a head transplant in Russia or something. I never saw much more about it, but that theoretically to me, as a layman idiot jiu-jitsu guy, it seems like okay, the brainstem problem, I could see that being a problem, but as far as the vascular stuff and keeping everything connected, it looks like you could just because we have like artificial heart pacemakers or whatever, right? Stuff.
Yeah, these are completely different things. So, for example, I hate to disparage my the
I want to transplant my head on Chase's body
right now.
I hate to disparage like urology or something, but think about kidney. The kidney is a filter, right?
Yeah.
So that's an organ where there's a pipe that goes in, there's a pipe that comes out, and as the blood goes through, the kidney's job is to filter the blood. So let's think about like a strainer, right? That's what the kidney does. And it uses some of the oxygen that comes into it through the artery to feed itself. So very simple mechanism, very simple method. Can we take that out of somebody and then plug it into someone else? And so take the filter out from one pump, plug it into another plumbing circuit, and have it work? If we take care of it properly, keep it cooled and what have you, sure. Let's go up an order of difficulty, like a heart, something with electrical activity, but very simple idea, meaning that it just contracts and relaxes. Do they take those out of people and then transplant it into other people? If you take care of it and what have you, sure. They hook it back up to all the pipes. So they put the pump back up to all the pipes, and that heart uses some of the oxygen that comes to it, and it forms a very basic function, which is to just squeeze and let go, squeeze and let go. Now, if you now take it up an order of magnitude, you're talking about an organ that requires basically continuous blood flow, continuous oxygenation, number one. It has to be hooked up to 6 pipes at least. So 4 going in, 2 major ones coming out, and that thing needs to be washing the brain continuously. The brain is sitting in a fluid, that's spinal fluid, right? So it's kind of floating within a fluid that's designed. It produces for itself to keep the electrical activity in the brain a certain way. It's hooked up to a lot of other organs, eyes, tongue, all the nerves that come out of the brain that innervate these muscles. Not to mention, let's say you cut the spinal cord, right? The information coming out of the spinal cord, going through the spinal cord, is from the computer going out to everything that you think of as being a part of life, everything connected directly, like one-to-one, one-to-one. So when people talk about stem cell research, consider the problem. You get a bruise in your spinal cord. So I take your spinal cord, which is about the size of my thumb, and I squash it to the point where a part of my thumb dies. But there's a whole bunch of like millions of billions of fibers running through my thumb up and down it. And the idea is, can we squirt something in there that knows automatically which ones to hook up to which ones millions of times over and get it all right?
No.
We're not there yet. But
Dang it!
That's the reality of the challenge. So can we transplant lungs and kidneys and skin and these types of things? Yeah, sure. But this is one that's very difficult.
I always think of when you say floating heads. I don't know if you've ever seen the show Futurama.
Oh, yeah.
They have all the heads just floating in jars and people are talking. But I think that's what a lot of people think is possibly going to be happening. You're able to just
very
take your brain
complicated, very
and just put
complicated.
it in there, and it's just going to be able to transfer.
Well, people like Ray Kurzweil and some of these other people are saying that eventually we will upload our consciousness or to some sort of a place. And again, that's the interface problem that we talked about earlier, right?
Yeah, you know, when I think about that from a conceptual perspective, do I think the neuro person in me who sees the brain as a complex computer, I have to believe it's possible, because really it's a neural network. It's a computer. It's a type of computer. And certainly there are computer systems right now that can do everything that our brain can do for limited directed tasks. The difficulty they have is in the networking and the spontaneous reorganization of how things happen. But when I think about what we are, and this is just kind of like more hypothetical now, what we are is we have a whole bunch of memories that have been put into us over time that we accumulated. And because of our hormone, our environment, our genetics, our culture, and everything, when we're given information through our ears and through our eyes and through touching it, we interpret it a certain way, we manipulate it a certain way, and then we store parts of it in our brain. Do I think that every one of those functions can be done in such a way that there can be a record of what I thought I experienced, the pictures and the feelings and everything? Sure. Are there ways that a computer might be able to observe who I am and how I make my decisions and what I like? We already experienced that now where, hey, I like that story, and you get another one and you get another one. So can they figure out those patterns? Sure. But the complexity of changing, evolving, adapting, getting a life stressor, and all of a sudden having an aha moment that changes completely the way you approach life in the next moment because somebody in your family died or because you saw an important movie and things like that. Is there a way to transfer your ability? So all your memories, you die right now, and I take your consciousness and transfer you over and then have you have that same ability to have those spontaneous aha types of things? I just don't understand how that would be. If you could do that, you could create a human being, in my mind. Right. That's the spark that makes you human, is the fact that I think I know you really well. I think I know everything about you, but can I really predict in the next moment the fact that you may say something completely unexpected that's unique to just you and your experience? I just don't see how you do that. Now, could they have a record of everything you experienced? I think, yeah, sure. Right. We can have a record of it, and we can download all of your life experiences.
So it would be more of a
log,
like a simulated version of you. But at that point, how do you distinguish? And that, there's a lot of people talking about that we might live in a simulated reality now. It's
Matrix,
the Matrix type of thing. There's a lot of
what's funny. We're into very theoretical and conceptual areas.
Yeah, that's where I like to live.
but think about it. Think about it. As trivial as you might think that might be, what would you do if we watch these movies where we saw Aquaman, for example, and he goes to find the throne. Spoiler alert for anybody who hasn't seen it. But
it's been out for a while. They're okay.
Yeah, and he sees his whatever, I think it's his father or his grandfather, and his grandfather's talking, and I think to myself, okay, well, we say that we can't simulate the human being, and all it would do is record. But if you could pull up your grandfather's life experience and get it told back to you in the way he experienced it, just to be able, like in a VR way.
Yeah.
I was watching, the kids and I were watching YouTube videos of these. There's a bunch of YouTube videos where these kids, these punk kids, are putting they're putting VR goggles on their dads, like these older guys, and then they're running them through some virtual reality, and the fathers are falling off the stool and they're laughing at them. But I think to myself, think about that. If you could say, gosh, I wonder what my great grandfather in his time, and while we may say, gosh, that doesn't really reflect me because it doesn't really simulate who I am as a human being, but if you could take Lincoln's feelings and be in a VR situation and experience a subset of something, I wonder what he felt like around this time, and just be able to play a recording of what he felt and thought at that time. What type of world would it be if we actually could experience things like that? And so that's what I mean. Like, it's obviously this is very wild and imaginative, but do I think that there would be a tremendous value in just having records of our consciousness and the way we experienced it, just to be able to say, because right now, think about it, books, great speeches, movies, we all talk about it as if we even can know what that author was saying and what have you. But could there be in the future the ability to just actually say, well, let's hear what they heard. Let's see. And, but that's not what he saw. We have a picture of it. Yeah, but this is what they experienced. When they saw this, when they heard this is what they experienced, and that's why they wrote this or that. I just think that would be phenomenal.
That would be
phenomenal, because that's the problem with human beings, right? The problem with human beings is we have a kid, and the kid is like a brand new computer with no software, and they've got and they can learn.
Write it.
And they can learn something that's completely corrupted. You may want to load them with all of your software, but guess what? So every generation of human beings, they're starting from scratch again. And our only way of getting the information in them is reading YouTube videos. But how great would it be if we could say, hey, your great-grandfather, this is what his life was about.
Here's the experience. Check it out.
It would almost be like taking a video camera and just always having it on you at all times.
Yeah.
But the brain's uploaded and the data's uploaded, though, so you could even get probably more in depth that way.
Think about the movies that we always see. It's always these very touching scenes where you can see the history of somebody, and it's flickering like a reel to reel, and you can see, and it always is touching. We're always drawn into it because we get a sense that we are experiencing what they experienced. And so when we talk about the potential for the future and being able to, do I think that we could transfer all of our consciousness? No, but could we, even if you think about Facebook, big data, the memories, when Facebook will put up something, a memory from so-and-so, think about all of the photos and videos and everything that are aggregated that maybe one day when we die, all of your data will be aggregated in such a way to say this was Chase's life.
Black Mirror, here it comes.
And it'll be a whole bunch of pictures and videos aggregated of, hey, what was his life like when he was in his 20s? Mm-hmm. Here are all the videos and photos of the things that his life was like when he was 20s. We now, think about this, we have access to that. You don't have access to that for your grandfather.
That's true.
That's right.
So it's very interesting. Your kids will be able to say, I wonder what my dad was doing what did he look like? He keeps telling me to cut my hair. Look, his hair was like this big. That type of crazy stuff.
So what you're saying is we can't be as hypocritical anymore.
Yeah. Well, certainly that's not the case now. They're digging up pictures from 25 years ago.
That's right.
Gotta be careful.
Yeah.
Oh my goodness. That's fantastic. Okay. Well, man.
We just went down. Several. That was awesome.
That was very good. So, and Chase touched on it briefly. He talked about you've done other martial arts other than jiu-jitsu. Just tell us briefly, what kind of martial art background you have.
Well,
I don't know if it can be brief.
Yes, I can
extensive.
I can make it super brief. I think, I was thinking about this on the way over here. Gosh, I've done a bunch of different things, but I say that I think what I really appreciate about the academy is studying. And I think that I have been studying martial arts. I've been experiencing martial arts probably, 30-something years, 38 years, something like that, long time. But studying martial arts, I think I really started studying it and deciding like a path through it with Aikido. I did striking before then, but I was a kid and you don't really, you do it and you jump through the hoops and belts and things, but you don't really appreciate it. I was really influenced by my Aikido instructor at the time. And he learned Jiu-Jitsu from Moses Powell, and then he learned under Yamada. And he was so I started with Claire Keller, and then Carl Riley at the Brooklyn Aikido Club. And and in that dojo there was also Jiu-Jitsu, and I learned Jiu-Jitsu for like 2 years, Japanese Jiu-Jitsu. And then I went to medical school, and in medical school I continued doing Aikido, and then I also studied a little bit of capoeira at the time, but all Aikido. I went to residency, and in internship last week of internship I broke my knee.
Oh my!
ACL tear, and I couldn't do Aikido. I couldn't get to the classes because of school. I started doing Tai Chi, and to help strengthen my leg. and I was limping all the time and everything. And I studied Tai Chi. I've been doing that for, I don't know, 20-something years or something, 19 years. And in the meantime, let's see, when we were in Iowa, we did capoeira for a couple of years. It was the only martial art. Well, there was a karate guy there, and I used to teach Aikido there, and I taught Tai Chi there. But I studied Tai Chi for a while there because there was not a lot of other people around. The kids came along, and we started capoeira. Did that for a couple of years, and then we came here. And here I've done some boxing, now Jiu-Jitsu. So that's the background.
Do you find that you use anything from jiu-jitsu in your day-to-day life? I know a lot of people talk about that stuff, but I was wondering if you did.
Oh, yeah, all the time. I mean, it's hard. I like to consider myself a martial artist. I don't know that I've had to fight in the past, and we all have to fight physically, emotionally, psychologically, but, Tai Chi is about the correct, my teacher would say, it's about the correct application of force. And you really exemplify that at your academy. You guys really exemplify that. And I think that's something that really strikes me, is that what's most important for you, at least what I'm getting from it, is you guys focus on very technical things about the right thing to do at the right time, in the right way. And when you ask, is there a time in your day-to-day life where you think about doing the right thing at the right time, in the right way to get some result? All the time.
Right.
Especially in your profession.
All the time. Yeah.
You need to be right a lot.
I was discussing this with somebody today. I said, the reason my kids are at the academy is because I want them to have the ability to be able to negotiate with people. I don't, they've studied striking, and they can do that stuff, but that doesn't help them to talk to people and talk them down, and doesn't give them options. And that's why I wanted them to go from a place where all they ever knew was punching, kicking, stuff like that, to being able to say, hey, do we really have to do this? Can't we just stop right here?
Negotiate.
And can we negotiate? And so when you say, do you use it? Do you negotiate? Do you hold things and hold up people with ideas and stop them from doing, and squeeze them a little bit and encourage them to go in this direction? And that's every day. Every day.
So since you were such a already seasoned martial artist, why did you, was it just because you were in a new place or whatever, so you're seeking out whatever was there, but why did you get it? Why did you start Brazilian Jiu-Jitsu?
I did it because, number one, I wanted my kids to do it, and I wanted them, they've done a bunch of striking, but they didn't have the capacity. My oldest is in high school, and my youngest is in middle school, and I wanted them to have the ability to not feel like they had to escalate things up to the level
all the way
where
to striking.
Yeah, I mean, they have to think about it. They're encountering a situation, and maybe they feel like it's not really there yet, but maybe it might be, and they have to make the decision. Okay, am I going to go nuclear?
Knockout.
Am I going to go nuclear here and hit and cause? And I wanted them to have new tools. I wanted them to have different tools, and when they went into Taekwondo, I didn't really see myself bouncing around and kicking and stuff like that with them and what have you. But I told them, I said, if you got this is something I think you guys need. It's an additional tool in your chest. It's a community of people that you'll be able to go anywhere in the country and say you trained here, and you can go and roll on those mats. That's a little harder in Taekwondo and those other types of fields. And I said, I'll do it with you guys so that they could see that I wasn't, you guys are going to go do it. It'll be, I'm on the mat and I will do it with you guys. It's more of a do as I do, not as do as I say. And I wanted to have some of that experience because Aikido and the jiu-jitsu that I trained was more projecting and control, but it wasn't submission, not in the same way. I would like to say that what we did is, the best word I would put to it is control. The locks and the throws, projections, of course, if you throw them away, then you throw them away. But when we took them straight down, we were kind of controlling them. But I now know that we weren't really controlling them definitively. BJJ controls people definitively. And I didn't know how to do that. And I wanted to know how to do that. So that's what I'm getting out of this, is that cool. I feel like the things I'm learning, I actually have the option to control somebody completely in a way where I can say, hey, let's do X, Y, or Z, and I can actually do it. Whereas in striking, those other ones, no matter how much you hit somebody or you think you can or whatever, there's always so much unknown. And of course, there's unknown in jiu-jitsu too. But I feel like it's just a greater tool that I never had.
Were you, when you were studying Aikido, did you grapple with the jiu-jitsu person? Like, how did you get, like, was it just purely through the internet, or you saw people who were training jiu-jitsu? Like, well,
it wasn't BJJ, it was Japanese, and they were in the same dojo.
Yes, but
they were in the
but
same...
then did you eventually start grappling with the Brazilian jiu-jitsu? Like, how did you first even know what Brazilian jiu-jitsu was? Did you just see it one day somewhere? Or?
Through MMA.
Through MMA?
Through MMA and hearing about it here in the area.
Here in Oklahoma?
Yeah.
Yeah.
So, and, you know, and the other thing I would say, and you mention this all the time, and I've said this to the kids as well, is that it's a wrestling state. And really,
it is.
You know, I grew up in New York on Long Island, and there were wrestlers, but I don't know that I would.
Boxing state there, right?
I don't know that I would have said it's a wrestling state, and I don't know that I've lived. Iowa was the first place that I would say that I lived.
was a wrestling state.
Iowa was
legit.
Iowa's a wrestling state, and that was one of the first times that I was really conscious of wrestling. As I think probably that was one of the first times where I would have said to you, if somebody asked me, I would have said, that's actually an American martial art.
Sure.
Greco-Roman, you know, is an American martial art. And actually, you know, I would tell people, oh, you know, in Japan, people do martial arts. In China, people do martial arts and what have you. And I realized actually in America, they do martial art. It's called wrestling, right?
Yeah.
But Iowa was the first place that we lived where I would say the state practices a martial art. The boys in that state generally are trained in that martial art. And this place is definitely, you say it all the time. And I told the kids, I said, you guys are strikers. If somebody rushed you, you would struggle to deal with that person, to manage it. And so I became a lot more conscious of BJJ, the benefit of it, and the need to be able to play on that field since being really here in Oklahoma and raising kids in a situation, because, you know, I was already fairly mature in terms of my thoughts about martial arts. And for me, I'm a big guy. I'm going to have the ability to kind of theoretically keep people at a distance. And, you know, but as I'm getting older, I see it even as something where, you know, my striking is not nearly going to be what it was. It's never going to be as good as it ever was. But I think that jiu-jitsu can be as good as it ever was, the 100%. Way I see you guys showing it. And that's another reason why I wanted to do it with them, is that I saw it as something that I could do, that I could actually maintain a real concrete level of proficiency that I don't think that at this where I'm at right now with my body and my age, that I could do that at a striking level. I think I can do it at a jiu-jitsu level.
Sure.
You also can't let your kids creep up on you, man.
I gotta choke them out, man.
You gotta learn with them.
All jokes aside, though, I think that's really cool how I wish that my family came up grappling with me. You know what I'm saying? Like my sister and my dad and my mom. My dad, God bless him, he would get out. I did Taekwondo when I was young, and he would get out there with me in the yard, and we would put on sound horrible, but I couldn't afford chest protectors, and so my dad though had some life preservers that zipped up in the front. We would turn around backwards and zip them up, so there was a little padding, right?
Oh, Mr. Miyagi.
And my dad would get out there and just beat the crap out of me, because he was trying to get ready for tournaments and stuff for Taekwondo. So we would just clack shins and everything else. But I think back and I'm like, man, if we would have had grappling, we would have had such an awesome bond through that grappling. We have a great bond anyway, but just through grappling, I see that happen because we have a bunch of families at our academy. But how they always, the family unit looks so strong. We've had some there for almost 10 years. And so just the family unit with a grappling family is just so much stronger than I've seen in like really anything else. I've seen some of that in musical families where the whole family jams all the time and you know, but it's just very rare to find that in most other
I will
arts.
tell you that it's a big deal for us. Carlene and I are big with kind of cohesion, making sure that our two guys realize that they are each other's best friends. And it's very interesting, you know, they practice Taekwondo and they box, and but they don't, even when they were in the house, they wouldn't do that stuff to each other.
Right.
And they wouldn't, so meaning they wouldn't play with the ideas. When I was a kid, we would, like my friends who did martial arts, we would actually use it that way. That was the day of Bruce Lee and Chuck Norris and all that other stuff, and we were pretending, right? But my kids didn't do that. But I'll tell you, with the jiu-jitsu, oh my God, they're
grappling at home.
rolling all over the sofa, onto the bed, onto the floor, and get in my guard, and I'm going to submit you. And I think what I think it's a testament to just the art and how much fun it is, and that they are appreciating just being close to each other. And I think that that's huge, and it's priceless. I think it's priceless.
Well, and two, I think, as Ty has said, that we've had several families train over the years, almost 10 years. Yeah, we do have some families that have been there for a long time. But I truly think, me teaching a lot of the kids' classes too, if the more involved that the parent is, or the more involved that the family is in training and things like that, because jiu-jitsu is so hard to stay in long term. It's not like a lot of arts where you can get a black belt in a couple years or whatever. In order to continue that journey, having a strong support system, especially in your own household, is very, very important. So I always have told parents, like, oh, I want my kid to do this forever. How do I make sure my kid does it forever? And I turn and look at them. I say, then you got to get a gi and get on the mat.
Get in there.
Because that's the strongest way that you're going to keep them going. So that's it sounds like you already knew that from day one, but that's just what it is, and it creates that.
What's weird is we
bond.
almost have to trick people into letting us help them sometimes, and a lot of that trick is by almost guilt tripping them because the kids are in there, and we're like, well, just put on this gi.
Come help.
And come help us for a second. And next thing you know, 10 years later.
Well, I'll tell you, and I forget who I was discussing this, but I said exactly that. I said, when the kids started Taekwondo, I definitely knew that, I always recommend kind of parents start their kid off with striking generally, because I think it's just easy and intuitive. And for people, and you got to remember, and I was telling this to somebody, I started before there was anything like BJJ was even accessible. There was no option for it. And I said, if there was an option, I can see now that that's what I would have been recommending the whole time. But I said that, but realize, like, BJJ is a very, it's comprehensive and it's complete, really. And if you want your kid to do it, and if you want your kid to be in it, you have to be a part of it. And there was no question that I was going to do it with them. And I told him, I said, I will do it with you. I said, our deal with the kids was, you have to get your black belt. Once you get your black belt, because they complain, I don't want to go, and you don't have a choice. You have to go. When you get it, then you can choose, and this is what they're choosing.
That's awesome.
Which is cool. And they're still doing, they're still doing it in such a way that they're excited about it. They want to come, and they want to use the stuff they learn.
I am too. I'm still excited about it. It's like 23 years later. This is the only thing I've ever done for this long where I'm still excited to get up in the morning.
Me and Ty went to a seminar a few weekends ago, and we were like kids at a candy store.
I know, because when you came back, you were still beaming.
I
we've done it a lot, and we're still all about it.
So since you do deal with like the neck and the nerves and stuff in the thoracic and all this stuff, do you have any suggestions for BJJ players about the neck and spine health? Because a lot of people end up with, I guess, at the C6 or whatever, C5, C6 area in there that's jacked up from a bunch of different things, from wrestling the wrong way and from getting stacked and all these kinds of things. Do you have any suggestions or ideas?
Well, I can tell you that the major issue, we talked about it actually in one class. You may have remembered I talked about cranks, and I was just like, can you guys explain to me, what are we doing? Are we crushing the larynx? Are we squeezing the neck? Or are we cranking the head, cranking the neck? And I would say, generally speaking, if I fuse someone's neck, am I concerned necessarily that they get the neck squeezed side to side? If that was the only force being applied, no, it's not that big of a deal just to put your arm around and squeeze it side to side. The thing for people with their spine in terms of nerve compression is twisting the neck in such a way that it's not supposed to go. And when I say not supposed to go, they may have a normal range of motion, and then you can exceed that range of motion. That will cause problems. Or they may have an abnormal range of motion. Maybe they have a disc degeneration or a disc herniation or something, and their range of motion is very narrow, and you turn it what would be normal, but it's not for them, and it creates problems. So for people who have those problems, I would say you need to stay away from those movements. And I think unlike, and this is not my thing to say because, you're the boss, but I would say unlike some other arts where, for example, in Taekwondo, like if you couldn't bounce, if your ankle was bad or your knee was bad, you're kind of out.
Right.
Whereas I think in Jiu-Jitsu, if you can't do certain types of things, I think you can, I would say, I think you can still train, but you just need to be careful that you don't get into those things. Now, you mentioned, for example, getting stacked. If I said, hey, don't get into a headlock or a crank or anything like that, then somebody might say, get double underhook guard passed and stacked, and then it's kind of the same thing. They're getting flexed in such a way that they're getting compression. But I think if somebody was mindful and just, stayed away from that, they could roll and still not have a problem. They just need to be careful of those things.
Yeah, big understanding of what positions they can be put into and what positions they can't.
Yeah, and that comes down to having the right environment, the right school, the right instructors and stuff. One thing that I don't know if I guess it bothers me a little bit, but is some people will go have an experience at one school and then call it quits. And maybe because the school is super rough or crazy or whatever, and I get that. But there are a lot of schools out there that aren't designed to just be rough, that are really designed to take care of the practitioner from the beginning of the moment that they get in all the way up until the last moment that they can stay on the mat. That's kind of our goal, is to keep everybody there as long as possible. It's just because I want people to hang out with me. That's one surefire way of doing it. I'll just keep them there through jiu-jitsu.
I'll tell you, I took care of a 14-year-old kid, a wrestler, quadriplegic. Picked up, he was wrestling, and just kind of show you the difference between explosiveness, control, the training environment, and what have you. But he was picked up and taken down in a school event and came to the hospital, can't move his arms and legs.
My God.
Broken neck, and ended up being able to then walk. He came in quadriplegic, and then that was a spinal cord injury, and then recovered. But, when you talk about having an injury or having a problem and feeling like that might happen to you, I don't feel like, certainly in our environment, like tournament situation, fine, MMA, fine, and potentially other schools where people are not necessarily attuned. But I think to myself, I've been at the school for a little while now, and I don't know that I've ever seen anything where I would say that I think that type of situation would exist. But that was a 14-year-old kid's situation in school, right. And I think we trained seriously, and I don't think that would happen in our academy. Yeah. So I think it's something that you just need to be careful of. But I wouldn't even be concerned at all about that.
You heard it from the brain surgeon. Yeah. You can train jiu-jitsu.
You can do it. Just get in there and do some jiu-jitsu. Come on. And research it. Find places. Go online. Look at the reviews that the places have.
Visit
there. Yeah, visit. Look up the background of the instructor. Whatever you got to do.
And most schools offer some kind of a trial, like you said. Yep. So
Go and visit.
Try it out. I mean, see if the school's good. And then if you try it out, you do it, whatever. And if you don't like it, try a different school. Like, finish out your contract or your terms or whatever it is, and then go try a different school. But don't let one experience. And
I would say the other thing I would add is get girls into it. Girls into it, because I was having this conversation with someone today. Actually, I said I always used to recommend striking, boys and girls, because I think it's intuitive and what have you. But I said the girls, when they get to a certain age, the boys are out racing them in terms of weight and muscle and speed, and all the same striking stuff that worked for them until they're 10 or 11, until the girls are that age. I think boys and girls about the same. But then when they get to that age, I think the boys outpace the girls, and I think there's some girls that outpace others, that the striking, unless the girls keep up training accuracy and force and they're conditioning themselves, I think that their ability to use that striking effectively when they get into the ages where the boys are outpacing them. But I think that if they picked up jiu-jitsu at that time or even before, I think they can continue to be effective. So I for girls, where the boys, if they said, "Oh, I love striking and punching," fine. If you like it, that's fine. But if you look at the types of arts that are available, and for a girl or somebody who's potentially weaker to be able to level the playing field, BJJ is it. And I really believe that.
I do too. I think that's Chase. How many girls you got in your kids class right now? It's like almost half and half.
It's almost half and half. And I've been teaching kids for. Ty, you've been teaching kids longer, but I mean, at one time it was even at kids, it was a very male dominated. But I would say over the last 6-7 years that I've taken over the kids and really had more of a hands-on, I have probably more new female students
It's
at
gotta
a
be
younger
empowering.
age,
It's
right?
got to be empowering for the girls.
We're lucky because my wife is there, and she champions a lot of this stuff and pushes the Jiu-Jitsu movement.
Good role model.
Or what up there. And so that's helpful too. But we have seen a huge influx in the last few years just in Jiu-Jitsu period of just an explosion of female grapplers coming up. And it's pretty great.
As we say that, the other day, Austin taught the advanced kids class, and that class isn't super huge. We really only got like 10 or 12 students in it, but it was all girls that showed up that day.
Yeah.
So Austin, who is like our biggest and baddest like tournament person, he's in there teaching like 6 girls.
Yeah.
Yeah, and they're the ones that are in the advanced class because they've stayed long enough and they
will
realize
choke you all
they will
unconscious.
choke
Why?
you all
Why do you
crazy.
think that is? Because I don't know. I don't know if I would say that. I don't know. This is me, just a regular guy talking generically. I don't know if boxing gyms, striking arts are they also seeing a big uptick in women?
I
Why would
think-
it? Because something.
Here's what's
because
happening.
BJJ is getting that
Dudes-
exposure through MMA, and so
Guys are sitting around with their buddies and they're watching the UFC.
right.
And then they're like, I have a daughter. And they're like,
Oh, I get
That's,
you.
I think, the large
They see
majority
the
that I see
effectiveness
coming in,
of it,
They're
and
like,
they
nope,
wanna-
my daughter's going to jiu-jitsu
Gotcha,
today.
gotcha.
Yeah.
So
Yeah, and I think they also, I think the education on people, like I think people understand now that like if they put their daughter in like boxing, for an example, like her trying to punch another grown male.
yeah,
I mean,
yeah,
I
yeah.
think at one time that was a line. I think just punch him in the face,
Right,
and
right.
all the problems would be solved. So I just teach her how to throw a perfect punch. But now I think with the UFC and the effectiveness and all the education,
sure.
whether that's through the internet or whatever, more
yeah,
people
UFC
see.
and YouTube.
Yep.
I mean, it changed
Yeah.
the game. People can see what really works and what really doesn't. And
Yep.
when you get somebody that really knows jiu-jitsu against somebody that really doesn't, it's
There's no question.
And also,
obviously a
that's what we're
difference.
talking about when we talk about like self-defense. We're really talking about hopefully, if someone has 6 months to a year of jiu-jitsu, a female has 6 months to a year, they're going to be able to defend themselves very adequately against someone who's much bigger and stronger. Now, I mean, there's the arguments of, if the person knows a little bit, yes, maybe the male for being bigger, stronger, faster, but most likely when you get into a self-defense, it's not two people that know something.
Yeah.
I mean, hopefully she's gonna be able to defend herself. I know my first person I ever grappled with was Jin, and she beat the living tar out of me.
Yeah,
Not
no
like even in
striking.
a mean way, but like we were about the same size, and I just couldn't do anything. And I was like oh my god, that's what sold me. Really, that's what sold me.
I think a lot of people that are just deceived about what's actually necessary to be effective with striking, precision and accuracy. And even if you use gloves, you just don't appreciate that your hands are not that big without gloves.
Yeah, that's right.
And they're not that tough and they're not that hard. And if you don't have that accuracy and that speed and the reflexes, the stuff you train may not be as effective as you think.
I agree, but you're preaching to the choir over here.
Yes, we're
Hey,
not
so
gonna talk about how bad you.
We're gonna let our
I guess we gotta-
fans and stuff go. We've
gotta
talked
wrap
for
this up.
way too long. And typically, I don't like to talk longer than 20 minutes, but we had Caple here, so it was way worth it.
We can always have them back too.
I plan on it. So if we
Happy
haven't
to.
asked anything that you think we should have asked, put it in the comments below, and we'll try to.
Cable, is there
Do
a
it again
way
sometime.
that I don't know if you do social media or anything, but I don't even know if you take requests from people. But is there a way if people had questions? Is there a way they can email you, contact you? You may not want to give that out, which I
wouldn't
totally
give it
understand.
Out. Never give it out. Just say go to the.
Just
go to.
I
Talk
mean,
to
Chase
Ty.
has horrible ideas.
Talk to Chase.
never mind. I don't know what he's trying.
Life
I don't know what he's
podcast.
trying to promote.
Put it in the
I don't
comment
know.
section.
Put it in the comment section.
Brain surgeons don't have to promote.
That's true. Very true.
People are dying.
We
to get
do.
in the office.
We
you
have to
know?
promote.
we
Put
do.
it in
Speaking
the
of
comment
promotions,
section.
We have a promotion. Yay. We have a Patreon page. Patreon. And it's where that you can support our to-dos and to-don'ts. We, as you can tell, our microphones don't actually match. And that's because we've kind of like pulled things out of here and there. This is actually my band microphone that's toured all over the world right here. And this is not made for podcasts. So anyway, our Patreon page is going to allow us to get things that are, the real mics so you can hear us better.
I have the
Fair.
one that makes me sound like Barry White.
That's
Yes.
right. You got the good one.
Caple's got the great one. We're hopefully going to get 2 more.
Yes, soon.
But yes, if you want, you just go to www.patreon.com/submittinglife. We'll put it in the show notes and everything too. But we have
some different tiers of.
We got
things in
different
there.
tiers. We got anything from $1, which basically just means you like the show. Anything up to $5, which we tried it today, and your phone died, but that's okay.
Oh yeah, so my phone is dead.
But we're going to start doing things. If you're in different tiers, you're going to get behind the scenes access to what we do to set up the show and some things like that. Because as Ty said, that's really where the golden nuggets are. That's where
yes.
a lot of jokes are happened, and you get to see how dumb we really are. So,
and then plus we're going to shoot some like technique videos and stuff too that will only be for those guys, girls.
Yes.
So yeah.
and you just help support. If you like the podcast, that gives us an incentive to keep going. So
yes,
which we want to do it.
It's fun.
Anyway,
all right.
Cable,
Well,
you have anything else you want to say?
No, I really appreciate it. This was very
thank you
interesting.
so much.
It's very interesting. Yes.
Honor having you here
problem.
today.
Thank you.
Thank you, thank you, thank you.
I appreciate it.
Submitting Life Podcast. Don't forget us,
See ya.
because we can't forget you.
Oh my gosh.